When loading the needle, it's important not to grab the tip of the needle, which is typically a cutting needle. This will dull the needle and make it more difficult to pass the suture through the tissues. Therefore, you can either grab the suture itself and manipulate the needle, or you can grab the needle itself, being careful not to grab the tip of the needle and dulling it. Once the needle is loaded onto the needle driver, one can adjust the angle of the needle with the forceps. It's important not to grasp the needle too far backwards. This can make it difficult to drive the needle. Ideally, you'll grab the needle at approximately 2/3 of the distance from the tip and at a slight angle. When going through the tissues, it's important not to grab the intima. Various techniques exist. Placing your forceps or vessel dilator into the vessel lumen can be helpful to provide traction. You can either put in both of the forceps ends or just one. When passing the needle through, it's important to go perpendicular to the tissues. This allows the needle to pass easily. If you go at an angle, so-called skiving the needle, this makes it more difficult to pass the needle and can be prone to suture bending. As you can see, the first bite is taken here, then the second bite is taken. It can be taken as a single pass, or you can take it in two. It's important on that second bite to also go at approximately 90 degrees. Again, the tissues can be manipulated with the use of the forceps in order to achieve the proper angle. When retrieving the needle from the tissues, it's important again not to grab the tip of the needle, which can dull it, but to grab below the tip of the needle, and one can inch it forward, so to speak, slowly, so as to avoid torquing of the tissues. Notice that when pulling the suture through, the left hand with the forceps can control the vector of the suture to allow for easy passage of the needle. Pulling the suture straight up, such as this, will actually cause cheese wiring of the vessels and can actually cut through the tissue. So it's important that the suture pass easily. In this technique shown here, we are performing a so-called looping technique where the suture is passed for the necessary number of knots. Then the loops are cut at the end and then tied. By doing it in this way, this is a little bit more efficient than tying as you go, so to speak. It also allows the surgeon to get access to the individual walls of the vessel. In a tie-as-you-go technique, obviously the lumen is being sutured together as one goes along, and this can make subsequent suturing slightly more challenging, as it can be difficult to open up the vessel to ensure that proper bites are being taken. With practice, the loop technique actually becomes quite fast and efficient. One must be sure not to pull out any of the previously placed sutures. As you can be seen here, the loops are evened out by placing the needle driver in between the loops, and then each knot can then be tied. Typically, we start at the ends and work towards the middle. The order in which the suture is performed is not so critical, as long as they are evenly spaced. With the latex model, there is typically tension on the incision, so it's important to use a surgeon's knot to be able to get good approximation. Whenever there is tension on the vessels, it's important to use a surgeon's knot. Typically, this is very common, particularly with the stay sutures. Once stay sutures are placed, however, subsequent sutures can often be performed with a simple knot only. Again, with the latex model, there is inherent tension on the closure, so a surgeon's knot is typically preferred for the purpose of the model. Certainly, one can also perform surgeon's knots on all of their suturing in a real anastomosis for added security. As you can see here, the knots are being placed down square. And as you can see, the surgeon's hands need to alternate in their direction in order to provide a square knot. When cutting the suture, the tails should be left rather short so that they do not interfere with subsequent suture.